So one of the particular problems, of course, is that there are many respiratory conditions which produce symptoms which are a bit like having COVID. So, for example, if you suffer with asthma, if your asthma gets worse, it's likely that you would cough, you would feel more breathless. And although it's relatively unlikely that you would have a fever due to the asthma, if your asthma worsening has been triggered by some other sort of infection, not COVID but another virus, then your symptoms would appear to be very similar to as if you had COVID. So the way that we handle this is that the first thing one would do is one would need to contact the relevant healthcare professionals, whether it be through a GP service or through 111, to get some advice. And if it transpires that you need to come to hospital, we would do a test very quickly after arrival to see whether or not your symptoms were due to COVID or due to worsening of your underlying condition. There are one or two features which can help distinguish COVID from other conditions. So one of the prominent features, which has been well described, which I've only really found out about over the last few months, is the loss of the sense of smell, which isn't something you routinely see with all viruses. It can happen with some other forms of virus, but it's much commoner in patients who've got COVID. And also loss of sense of taste can be another feature. And obviously, if you've got a history of close contact with someone with COVID, it makes it more likely that your symptoms are due to COVID rather than some other respiratory condition.